about a 3 or 4. That's just what it feels like. BPH stands for benign prostatic hyperplasia. What we know right now is that a third of men over 50 will seek treatment for their BPH. I'm convinced the other 2/3 are just sitting at home wishing there was something easier than what's out there.
I decided to pursue therapy for my BPH when my nocturia, or getting up at night, reached 3 or 4 times and started to interrupt my sleep.
It has been going on for several years, although I just thought it was normal, having to urinate a couple times in succession after going once and then having the urge to go again.
You know, I love my husband dearly, but it got to be an annoyance that anytime we went anywhere, he went to the bathroom 2 or 3 times, even eating out, and I realized that he did have a problem.
I chose the Urologist procedure for a number of reasons. One of them was that it had been shown to not affect sexual function. There's no thermal effect, there's no cutting, there's simply the placement of this, this device which physically opens the prostate without damaging any tissue.
And I came across an article a couple of months ago explaining this new procedure.
Urolift offers several important distinctions. It's truly minimally invasive. It's performed in the office under local anesthesia. Recovery is rapid. Men don't usually miss work for this procedure. They go back to work the next day.
Well, I was in a unique position because I had been involved with the research on the Urolift procedure and had been present for procedures that were done during the Urolift study. And I also followed these patients, some of them now for years, following their procedure, and was impressed enough with the quality of life that these patients had enjoyed following the procedure and how much it had improved their symptoms.
I just had the procedure completed about 5 minutes ago, and when I went in there to set me up, it was a very comfortable atmosphere that I went through.
He did take some medicines to make him drowsy, which we offer optionally. He elected to take those. For that reason, he won't be driving home, but he's riding home to Montana today. That's, 8 hours, and I don't have any problem with it.
Oh, I feel very good right now, just like I would normally. On the farm, since the procedure, I'm able to stay on a tractor all the time. I'm able to drive a truck when we're hauling wheat to the elevator all the time without having to stop along the road or in the field.
I thought it was wonderful. I couldn't believe how quick his recovery was, and it was like nothing at all. I mean, he was groggy afterwards, but that didn't last but the rest of the day and a little bit of the next day, but he did great, and he had no problems at all.
I would recommend this procedure absolutely to anybody who needs it.